going into this one, I would like to just rush up with this kidneys, because Dr. Ihab has beautifully presented about the skin epidermal disease, especially the separation conflict. But it covers only one germ layer. Today, I am going to discuss about kidneys. Just have a look. Kidneys are a pair of bean-shaped organs positioned just retroperitoneally, and the right side is little bit lower and left side is a little bit up because of the liver. Make space for the liver. It weighs about 110 to 140 grams, and it's 6 centimeter wide and 12 centimeter long. And the basic function, you just go with the function. The basic function of the kidneys is to filter the blood. Approximately 180 liters of blood has been filtered daily by the renal parenchyma. These are the three structures which is there in the kidney: renal parenchyma, kidney collecting tubules, and the renal pelvis. These three structures are very important for the functioning of the kidney. Renal parenchyma forms the bulk of the kidney, and its function is to filter the blood. As I told you, nearly 180 liters of blood per day it has been purified, and 95% of this filtrate has been reabsorbed by the loop of Henle and other tubules, and only 5% is going out to the collecting tubule, through which it is going through the ureter. Then Dr. Ihab has already described about the embryological function. It is very important for a practitioner to have a thorough understanding about the three germ layers. That is why I am also emphasizing about that embryogenesis. Actually, it is a process of initiation and development of an embryo from a zygote. How this process is going on and how these three germ layers are coming up. That is what we are going to explain now. After fertilization occurs in the fallopian tube, the zygote begins to divide into fallopian tube itself. First, into a two nucleate cell in the first day itself, first day of fertilization itself. And series of consecutive mitotic divisions occur in the fallopian tube itself, which will come into 2, goes to the 4, 4 to the 8, 12. When it comes to the 16 cells, it is called blastomere. It is on the second day of the fertilization. From this blastomere, it goes to the third day. That is called, this blastomere or this 16 cells are called morula because of its mulberry-like appearance. And it enters the uterine cavity on the third day, where it looks, all the cells look like same. Now, this has been differentiated into inner cell and trophoblast. You see, this is the inner cell and it divides into trophoblast on the fourth day of the fertilization. Okay. And on the fifth day, these inner cells are moving towards the end of this one, and the inner cell mass will be clubbing near the other side. That is called cavitation. That will be close to the uterine mold. And this inner cell mass will become the embryo as said by Dr. Ihab. And this one will become the placenta. And on day 7, implantation is there. There will be development of cell mass differentiation on the 8th and 9th day of implantation or fertilization. So on 8th day, this inner cell mass will be divided into 2. That is called bilaminar disc. First production of first germ layer, that is endoderm, has been developed, and the second one is the ectoderm. Upper side becomes the ectoderm. That is on the 12th day of fertilization. Then it goes into a trilaminar disc formation. That means in between the ectoderm and endoderm, one another layer is coming, which is called mesoderm. So on the day of 12 itself, ectoderm, endoderm, and in between mesoderm is forming. So this mesoderm is formed by the primitive streak, you see, and it spreads all over, and it is divided, it is going to the head part, you see, going to the tail part. By that way, the embryo is developing. So within 15 to 20, 23 days itself, 3 germ layers are developing inside our body. The importance of 3 germ layers are, these 3 embryonic layers will be there till the end of no differentiation. One germ layer never comes to the another germ layer. Endoderm will be endoderm till the end of your life. Ectoderm will be ectodermal layer through the entire life. The tissues and organs are derived from these 3 embryonic layers. So these 3 embryonic germ layers are very important for us in understanding GNM theory. These are the 3: ectoderm, mesoderm, and endoderm. Got it? Now comes the importance of this one. All these 3 germ layers in the zygote has been controlled by 4 areas of the brain. In our brain, there are 4 areas. These 4 areas of the brain has been controlled by these 3 germ layers. The 4 areas are, first is the brainstem control area, second one cerebellum control area, and the third one is the cerebral medulla control area, and the fourth one is cerebral cortex control area. This brainstem has been controlled by the endoderm. So all the endodermal structures are derived from brainstem, controlled by brainstem. Okay, and the cerebellum has been known as old mesoderm. All the structures produced by this cerebellum is called as old mesoderm, and all the structures which coming from the new mesoderm is called cerebral medulla. That is called mesoderm. Cerebral medulla and cerebellum 2 constitute the mesoderm, and the cerebral cortex constitutes the ectoderm. So depending upon the area where it has been, the organ has been developed, the control area changes. This is the importance of GNM. Okay, so when human beings are come together, conflicts are bound to arise. at least honest differences of opinion will crop up when human beings are joining together. These are to be dealt with as early as it has been noticed. We have been dealt immediately, it has to be dealt. Otherwise, if this conflict has been allowing to grow beyond a limit, that will affect a person's health and well-being. The psyche is the one. Whatever you think, whatever you feel, whatever you perceive will register on a particular part of the brain which have connection with that particular part of the body. This is the beauty of our body. So whatever ideas you are generating, that will affect the particular part of the brain which have effect on the body. So according to GNM, the diseases are not really diseases. These are a specific biological special program organized by the brain to overcome this psyche. Whatever thought process you are having, that will be registered in the brain and will be showing us in the form of signs and symptoms in the body. So most of our organs are derived from one germ layer, as said by Dr. Ihab. Skin, epidermis, has been made by one single germ layer. But some organs are composed of either 2 or 3. In case of alimentary tract, whole alimentary tract has been made by the endodermal tissue, but the entrance and exit has been controlled by the ectoderm. So 2 germ layers are there in this particular alimentary system. In case of skin, epidermal layer, Dr. Ihab has clearly explained about the separation conflict and how that affected in this one. But in case of alimentary system, there will be 2 conflicts. If it is inside the alimentary tract, there will be a morsel conflict. Something has taken but cannot able to omit out. That might be the conflict in this case. And in case of outer, this one, I wanted to take something, that is ectodermal, or I wanted to expel something, that will be the another conflict. But in case of kidney, you see there are 3 layers: kidney parenchyma, kidney collecting tubule, and renal pelvis. In that one, this kidney parenchyma has been controlled by new mesoderm, and this kidney collecting tubules has been controlled by endodermal germ layer, and this renal pelvis has been controlled by ectoderm. So 3 germ cell layers are there in kidney collecting tubules. So whenever 2 or 3 layers are there in a system, there will be different conflict affecting different area. You see, kidney collecting tubule, that is the endodermal. You know, endodermal layer is the first layer which is formed in the body. The life starts from the water. Okay, so endoderm is the first one which started, followed by ectoderm. I already told you, whenever the life, the life comes out from the ocean or from the sea, they want to get protection from the sunlight and other approaching enemies. To avoid that one, ectodermal tissue forms. Then in between, mesoderm comes. Why? They need locomotion to run and this. So this is the way how the body has been made inside our womb. So in this, the first thing which I am going to tell is the kidney collecting tubule. The function of the kidney collecting tubule is to This is the kidney parenchyma. Whatever urine has been formed inside the kidney parenchyma, it has been funneled to the cup-shaped calyces and keep it there, and it has to be passed through the renal pelvis. This is the function of this kidney collecting tubule. It will pass from this kidney, collecting tubules to the renal pelvis for the excretion. So the kidney collecting tubules are the oldest evolution in terms of kidney because it is the endodermal tissue. So the conflict, the biological conflict which connect with the condition in this kidney collecting tubules are, the first one is fugitive conflict. That means fugitive is a conflict or a person who is on the run or who has escaped from something or he has been hiding. That is called existence. How I can exist in this world. My job has completely gone. I have been thrown out somewhere. So I have been isolated or abandoned. Or conflict of feeling too little. I don't have enough water to drink. You see? So this will be abandoned, existence, or I am like a refugee in one place. Somebody has to help me. I don't get enough water. Somebody has to. These are the conflicts which affects the kidney collecting tubule. And whenever this conflict comes, what will happen in endodermal layers? Actually, it has been coming from the intestinal cylindrical epithelium. So it will be cylindrical layer will be there, and there will be increase in the cell growth. The growth of the cells will be increased so that the water can be stored there so that I can stay long. This is the conflict that you said. What is the feeling? Biological purpose of cell increase is to hold the water and other urea, other creatine, other contents will be more at that. So whenever that feeling will be there, and if that feeling stays in, how long it stays, depending upon the intensity of the conflict, the water clogging and other things will be there in this particular stage. So whenever this this increase in cell growth will be there, the symptoms will be, there will be baggy eyes, water retention will be there all over the body, increased level of uric acid will be there, increased level of urea and creatine will be there, and there will be decreased urine output. So that what is the purpose of this one? So that I can stay long. So whenever the conflict got resolved, biological meaning is hold back water and urea. I would like to hold back all these things so that I can stay long. And whenever the resolution starts healing, that whatever the increase of the cell growth will be there, that will start degrading, as a result of which more urine flow will be there. There will be increased urine content, and the urea and other things will be decreasing from our body. This is the conflict which affects the endodermal layer, which is the kidney collecting tube. Then comes the kidney parenchyma. Kidney parenchyma is the one which forms the bulk of the kidney. The main area or the main functioning of the kidney is being done in the kidney parenchyma, composed of millions of nephrons. And its function is to filter the blood and produce urine. The filtration process has been done in the kidney parenchyma. And each nephron consists of glomerulus, glomerulus, which has been covered in the Bowman's capsule. So it is the blood pressure which regulates the blood flow inside the Bowman's capsule and the small blood vessel, keeping the kidney function normal. So whenever you are having some conflict, that means water conflict or fluid conflict is the conflict which has been mentioned, because water conflict means if our place has been flooded by water, that is called water conflict. Or if someone fall into in some pool or some ocean where I cannot able to swim, non-swimmer in the sea conflict. Okay, or water conflict, too much water is there, or water leakage, pipe leakage causes so much of water. This is the conflict. Or the fluid conflict, another is called whenever you are going for an injection. Some people will be very afraid of injection. That's called fluid conflict. So if that type of conflict comes, in case of kidney parenchyma, in the endodermal tissue, there will be first cell multiplication followed by cell degradation. In case of mesodermal layers, there will be first cell degradation, necrosis will be there in one or more places. So whenever the necrosis comes, as said by Dr. Ihab, there will be vasoconstriction will be there. Blood supply will be less. More blood pressure will be there to push that blood, as a result of which hypertension will be the effect. Elevated hypertension will be the effect in this one. And if it stays long, this elevated hypertension can cause other problems inside the body. This is the active. And the biological meaning of this cell degradation is to make more space so that the filtering capacity and the urine making capacity will be more. So all symptoms which we are seeing in our body is having biological meaning. So in case of kidney parenchyma, the conflict will be water conflict followed by necrosis of this one. And whenever the healing phase comes, the cells will be replenished or the normalization of the function will be there. There comes the need of bacteria and viruses. In the fourth, as said by Dr. Ihab, up to 3 biological law, he told. The fourth biological law is the viruses, bacteria, fungi are not enemies. They are the one which reduces or replenish the cells which has been formed during the conflict active phase. If that virus, bacteria and other thing is not there, then the degradation will be affected. It leads to other kidney cyst for renal cyst formation will be there. Nephroblastoma can come. So much of conditions can come. So this is the conflict which is there in renal parenchyma. That is called mesodermal layer disease. Then comes renal pelvis. Renal pelvis, the function of the renal pelvis is to funnel the urine which has been coming from kidney collecting tubule and send it to the ureters and taking it out. And it has been controlled by the ectodermal layer. Ectodermal layer. So all the openings, this tube, everything will be covered by ectodermal layer. And the biological conflict related to renal pelvis is the territorial marking conflict. Territorial marking means I cannot able to mark off my territory depending upon their gender, because in ectodermal diseases there will be laterality, as said by Dr. Ihab. Right side will be for the husband, job, and the left side will be for the mother, pets, child. It stays only mainly in the ectodermal layer. So the territorial marking conflict is the one which called someone has intruded into my territory. You know, the wolves and the dogs are marking their territory by urinating. So I cannot mark this territory. Somebody has entered. I cannot mark this territory. Okay. So this territorial marking conflict is the basic reason for this renal pelvis diseases. And whenever the conflict is active, there will be same necrosis, cell degradation of the renal pelvis mucosa, so that more urine production can be there to mark that territory. This is the thing which we have to know, the biological meaning. Enlarge the volume of the renal pelvis so that the widening the ureters and they will be passing. Okay. And in the healing phase, as said by Dr. Ihab and me, there will be a restoration of the urothelium and inflammation of the renal pelvis. So these are the things these are the conflicts which can affect the renal pelvis. Oh. So in kidney diseases, so in nutshell, there are 3 layers, germ layers are there. Depending upon the germ layer it is affected, the conflict changes. Okay. Now, how can we apply GNM in our practice, day-to-day practice? So I'm so thankful to Dr. Motiwala for giving us a valuable information about applying GNM in our practice. First thing which we have to do is, we have to understand what is the significant biological program associated with our symptoms. Whenever we see a patient with the symptoms, we should understand what biological significant program this patient will be having. First thing which we have to see. Second one, after finding the conflict, we have to make measures to resolve the conflict first, or downgrade the conflict as soon as possible. Seek some temporary distraction from that conflict and avoid tracks. Tracks you might be knowing. If again that conflict is there, or if then the memory, if it is there, again that conflict will come up. That has to be avoided. There are 5 methods